far more unites us than divides us.
We live, we love, we learn, we work, we play, and we get sick.
Anyone can get cancer, but not everyone has the same access to cancer care.
This can change. It must change.
World leaders, those with the power to make that change, need to hear our message.
We need your help to make sure it's heard.
There have been incredible advances in cancer prevention,
Diagnosis and treatment for some.
But not for all.
income, education, geography, and discrimination can all affect the treatment and care we receive.
Differences exist between countries, across age groups, and inside the borders of all nations,
Wealthy and poor.
Where you live, who you are, who you love, it makes no difference to cancer. Why should it make a difference to cancer care?
United, we can tell governments that this matters. Together, we can be a part of the solution.
Will you add your voice?
Demand equity for cancer care and help us close the care gap.
Hello, good afternoon, everybody. Welcome to the Cancer Language Training for Africa 2024. This is the very first edition. It's very important for us that this topic has come up at this crucial time as a commemoration of the World Cancer Day. It's one of the gaps that needs to be closed in Africa. There's a lot of stigma, a lot of blame, a lot of superstition surrounding cancer and cancer care. So today we would like to introduce your moderators, Dr. Iyobosa Uwadiae. Dr. Iyobosa Uwadiae is the Secretary, Nigerian Association of Medical Physicists. She's a board-certified clinical medical physicist and a teacher. She's head of the Medical Physics Department of Radiation Oncology, University College Hospital, Ibadan in Nigeria. She is the Secretary General of the Nigerian Association of Medical Physicists, NAMP, a member of the NAMP Clinical Training and Certification Board, and a fellow of the International Atomic Energy Agency, IAEA. She is passionate about the development of medical physics and the fight against cancer in Nigeria and Africa. Dr. Iyobosa, it's nice to have you on board.
Good afternoon.
Good afternoon. Good afternoon, Dr. Iyobosa. I'd like to also introduce Idah Phiri. Idah Phiri is the Communications and Administration Manager of the Zambian Cancer Society, who has made a significant impact as a young cancer advocate in Zambia. She serves as a cancer country champion under the Union for International Cancer Control, UICC. Ms. Phiri is the co-founder and chairperson of the Cancer Smart Youth, a program under the Zambian Cancer Society. She is the president of the Rotaract Club of Lusaka and a teen TV presenter at Movie TV, one of Zambia's first private television stations. Ms. Idah says her work career has been encouraged by a quote from Steve Jobs, which says, "The only way to get great work is to love what you do." I'll leave you in the hands of Idah Phiri and Dr. Iyobosa Uwadiae. Thank you very much.
Okay, thank you very much. Like I have been introduced, my name is Idah Phiri from Zambia. So I'm going to say good morning, good afternoon, and depending on where you are. So we're first going to start by playing the Bob's Pledge video. Then thereafter, we're going to dive in our program with very interesting presenters and facilitators that we have for the day. So can we have the Bob's Pledge video play?
I pledge to my boobs,
regardless its size,
to keep it safe and self-examined.
To caress and feel for lumps every month. Then report to the doctor if any is found.
I pledge to my boob,
regardless its size,
to always look out for cancer signs.
For a healthy boob
is a healthy me.
So help me God.
Thank you very much. So our first speaker for today, we're going to hear from Dr. Nchiewe Ani. Dr. Ani is the president and founder of Pink Africa Foundation, an organization dedicated to a better Africa, especially for women and children. The organization is renowned for its medical outreaches and events centered around cancer awareness, advocacy, mass screening, with a particular focus on breast and cervical cancer. Under her leadership, the Pink Africa Foundation has launched numerous initiatives aimed at educating the public about the importance of early detection and mass screening, including their flagship event, the Calabago Pink Day, impacting over 20,000 people across 6 years each October. So Dr. Anne is especially concerned about the well-being of patients and survivors, and her unwavering commitment and deep empathy for those affected by cancer led to the establishment of a breast cancer support group for African survivors, Pink Empress on World Cancer Day 2023. So I am going to allow our Pink Lady to come on the screen and give us that welcoming remarks. Thank you. Pink Lady, over to you, ma'am.
Hi, everyone. Good morning, good afternoon, good evening, from wherever you're logging in from all over the world. Thank you, Idah. It's an honor to have all of you on the Pink Africa space to talk about cancer language training. As we all know that cancer is a formidable enemy. It knows no boundaries. It knows no political affiliation. It's not a friend to anyone. It can attack you irrespective of your financial status, where you live, what language you speak, and what quality of air you breathe. So we are here to run cancer down and run it to a standstill. Amidst the fight we have that has been ongoing, we have realized at Pink Africa Foundation that language is the formidable barrier with respect to attaining the type and quality of care we want for our patients, and in terms of reaching out to our patients if we find ourselves in the shoes of healthcare professionals like I do. And so we decided to put together a cancer language training where we will bring together both patients, doctors, we'll bring together oncologists, oncologists, radiologists, physicists, medical doctors, nurses, social workers, patients, caregivers, psychologists on one space to talk about language. How do we break the news of cancer to our patients? How do we tell someone they have cancer in a language they can understand? And if possible, can we speak the language or the local dialect of the person to whom we are communicating with as healthcare professionals? And for us, or those of us who are caregivers, those who have cancer, how do we assimilate what has been taken or what has been put before us? Do we understand? Do we know the right questions to ask? Do we know how to go about or navigate the cancer space, or to go from point A to point B with respect to finding care, finding cure, or in attempting to fight the disease? That is why we have brought all of you under one umbrella to talk about language. Every healthcare professional or advocate deserves the ability to discuss cancer with clarity and compassion. By bridging the gap between medical terminologies and the patient, we can enhance patient understanding, reduce fear, and promote equitable access to cancer information. Like I said earlier, cancer does not discriminate, and neither should our communication discriminate, or form a hindrance or a barrier to attending optimal or universal health care for our patients. I, at this juncture, invite you all to be part of this transformative journey, whether you're a seasoned oncologist or a patient or a caregiver or a radiologist or a doctor, a general practitioner, a surgeon, irrespective of your trade, a nurse, or even whether even if you're an orderly, you know, we want you to be able to understand the basic terminologies surrounding cancer. Today, we invite you all to help us rewrite the language of hope, language of resilience, and language of healing. We urge you all to help us simplify the terminologies that are commonly used on the cancer space. We want to be able to understand everyone, and in that right, drive home the point that cancer cannot run us down with what we say and how we say it, and that we will be able to say the things aptly, rightly, and on time to save life. Welcome to first of its kind ever cancer language training on the African continent. From wherever you're joining us from, I implore you to pay apt attention, encourage other people to join. We're going to stream live on our YouTube channel. So if you have people who have difficulties joining on Zoom, please, the link will be shared on the platform. You can copy and share with your family, friends, and organizations so that everyone is on the same page. I thank all our robust faculty members and our resource persons. I thank you all for finding time to join us. Sit tight, wear your seatbelt as we take a cruise on cancer language training for the African continent. Thank you very much.
Thank you so much, Dr. Anne. I love the last part where you're saying, sit down, make sure you put on your seatbelts because we're going on a long drive, a 3-hour long drive, as we do our cancer language training for Africa, because we believe that the way you communicate with patients, with survivors, it matters a lot because healing starts from the mind, and it's how information is passed on from one person to the next. And one of the points that Dr. Anne has brought out is cancer is not a friend to anyone. No matter how much you know about cancer, you may know so much, but if you are told today that you've got cancer, trust me, it's not a good word. Those are not a good words to hear. And even as we reach out to people who are walking through the cancer journey, let us be mindful of how we speak.